All right, very good. Who are you?
Yeah, Mike Walker here in McKinney, Texas for about 22 years.
All right, Mike. So tell me what was going on with you prior to coming in for your consultation on regenerative medicine.
Yeah, I had been diagnosed with a torn ACL and experienced some difficulties, but mainly with skiing multiple days. So just wanted to understand what my options were for the torn ACL.
Very good. And what treatments had you done prior to coming in, and what future treatments were they talking about to you?
Yeah, mainly I had done a little bit of self-therapy, had built the strength in my knee through a lot of Stairmaster and building strength around it. I had one consultation with a surgeon to have it operated on, but he recommended that I didn't go through that since I didn't have any bone on bone, and generally my knee was healthy, just a torn ACL.
Very good. And what were your thoughts on regenerative medicine before coming into us?
I really had no expectations. I attended the seminar that gave an overview of what might be possible, and understood that I may not be a candidate necessarily for stem cell. Just coming in to get the initial evaluation, which was really a good process to go through.
Super. And what ultimately made you want to do regenerative medicine here at Freedom Health Centers?
Ultimately, it was discovering that through this self-rehabilitation and building up the muscles around my torn ACL, that I was compromising a lot of other structure and causing pain in my hip. I had a little bit of a curved spine where those muscles had drawn up to compensate for that torn ACL. And that those could be treated through a more traditional, not necessarily stem cell, but more traditional physical therapy and chiropractic treatment.
Very good. And so take us through the process of your care. What were your results? What did you like least about the care? What did you like most about the care?
Yeah, okay. Well, it's a fairly lengthy process, but given the fact that the ACL tear was probably 40-something years old, it takes a while to correct for a lot of the imminent damage that was done with the tightening of the muscles. So I went through a lot of processes in stretching and understanding how building the core as well as stretching out the muscles was critical. Also elected to do the PRP injections to help strengthen and get some regrowth around the ACL area. And I guess the thing that I like the most is just the whole process was convenient. It was my flexible schedule allowed me to come in on a pretty regular basis. The staff is very flexible in doing real-time assessments and then treating what needs to be done that day. The PRP injections were very straightforward and pretty easy to take care of as well. So overall, the process has been very positive. I can't think of any negatives other than potentially, if it wasn't for my schedule, I'm sure it would take a lot longer to go through the process as a whole. With appointments up to 3 times a week, then it's going to take longer to do that. But like I said, fortunately, my schedule allowed for the process to continue.
Very good. So, was it worth the cost to you?
Absolutely. In my case, insurance covered a fair amount of the costs. But given the fact that I'm now able to ski multiple days without any negative side effects where I previously had, that is worth a lot to me. So the cost associated with covering what the insurance wouldn't cover was definitely worth the expense.
And so, would you recommend the regenerative medicine protocols we have here at Freedom Health Centers to other people?
Absolutely, I'd recommend, and I have discussed with some people about the potential for stem cell, as that's a developing area, and we've had continued discussions with the staff here who are all very educated on it. And then other folks that have issues associated with just normal physical therapy, I definitely would recommend.
Awesome. Thanks so much.
Thank you.